I'm Amogha Agarwal, your host for today. I am a psychologist by profession, and currently I'm the director of SWISS and MSS Lab at MySafe Spaces. Before we start, a little bit about MySafe Spaces. So, MySafe Spaces is an organization that believes in helping institutions building holistic integrated wellness ecosystems, and we are doing that by bridging the gap between technology and human care. And currently we are running a pan-India movement towards student well-being. SWISS comes under that movement. That movement is the flagship of that movement is called SWISS, which stands for Student Wellbeing and Institutional Safety Standard. And SWISS Higher Ed is the program that we specifically run for colleges and universities. Our program stands on four core pillars. One is accessibility around mental health and support and care. Another is mental health awareness. Third is capacity building around the institution through training programs and workshops. And lastly, achieving the compliance for every institution. So the idea is to help an institution enhance their existing safety standards and well-being standards with collective collaboration and support. Today's webinar is where we will introduce you to this program, different elements of this program, and why this program is important. Now, before I start, I want you to take a moment and reflect of how much are you aware about the UGC mandates that have come out in January. If you feel like sharing, you can also mention it in the chat box. So UGC has come up with some strict mandates towards student well-being and holistic institutional enhancement around well-being and safety. But let me also take you back to why that mandate came up. A few years back, a 17-year-old girl committed suicide because she was preparing for NEET and she couldn't take the pressure, the academic pressure around it. That made her father knock the doors of Supreme Court, fight a long battle, and to convince Supreme Court to bring very strong, impactful changes in our constitution. The Supreme Court gave the verdict that the right to emotional and psychological well-being is now the part of Article 21, which is right to safety and life. And that change in our constitution led UGC to bring these mandates for all the institutions. And it took a girl, it took us, it took the institution, the system to realize the importance of this change when a girl committed suicide. We all are very well aware of what is happening out there in India today in regards to NEET and JEE aspirants. I will not go ahead by quoting those numbers because they're extremely distressing. But this is the reality that we are addressing. This is the challenge. This is the necessity that is really required to be addressed in a society. And that makes us bring this program, this movement, this intervention to you with the hope to collaborate with all the institutions out there and build safer institutions. And now let's start by understanding some UGC mandate. The campus mental health is now a legal obligation, where Supreme Court says that the right to mental health is an integral component of the right to life under Article 21 of the Constitution. UGC Uniform Policy on Mental Health has been issued, which focuses on certain pointers. Number one, there should be a mental health and well-being center in every institution where there is a private counseling space and there is a committee who's looking after all the safety and the wellness standards of the institution. There is a staff ratio that UGC has mentioned, which says that around 1 to 500 faculty members should be trained under different mental health trainings and programs, and 1 to 100 trained peer supporters should be there in the campus, which means for every 100 students, one peer student should be trained in a mental health training program like gatekeeping, so that they enhance the capacity building within the institution. And the ratio for staff is for 500 students, there should be one deputy faculty mentor for the same. The UGC also mentions that there should be a 24/7 crisis helpline So round the clock, they're integrated with telemanas and suicide prevention protocols. And lastly, there should be annual Manas Setu return, which is credentials, MHPs, anonymized reportings, and centrally monitored reporting. Now, why is this important? Why is it important to train the faculties? One of the core elements of SWIS is where we don't directly focus on the students because students already have so much on their plate. We believe that student well-being has layers to it. It is a shared responsibility. So if we have to address student well-being, we don't have to directly address students. We have to first address other stakeholders that are involved in that situation. And that brings us to faculty. More than 100 hours of contact is what students exchange with the faculties in colleges. But they have zero training towards how to address a student in distress. So teachers, professors, they spend a lot of time with students. They get to observe, they get to engage with the students in a very direct, objective capacity at times. And so it is very important for these staff members, for these teachers and professors to be trained in some way, in some capacity, so that they can address or recognize if a student is in distress. And imagine if every student has 100 eyes on them. Even if one eye recognizes that the student is in distress and that person knows how to support that student in that situation, we can prevent a lot of mishappenings in our country. So that is what brings us to training teachers under SWISS program. That is the first initiative that we take when we talk about SWISS. I'll explain the different components in the coming slides. Now, the ratio rule UGC will check. As I mentioned before, UGC highly focuses on these numbers where there should be faculty mentors with the ratio of 500 to 1, peer supporters with the ratio of 100 to 1. There should be a helpline number that is active 24/7. Currently, we have Telemanas helpline for that. And there should be a 1-year record retention, which is where there are records which are anonymized, records in the status of the well-being of the students, any reporting that has happened from the student side or even from the staff side. All that records should be presented and uploaded to the Manas Setu portal, and it should be anonymized. And there should be clinical files destroyed 1 year after the student graduates. So we destroy the data of every student as soon as the student graduates. So 1 design and 2 requirements are met. UGC requires referral pathways. A pre-funded anonymous teletherapy voucher pool satisfies that directly, and its anonymized record design simultaneously meets the confidentiality rule. Capped sessions keep costs predictable. Now, what is SWISS Higher Ed? In simple words, number one, it's a standard-based. Approach. SWISS Higher Ed replaces ad hoc responses with proven, repeatable, and protocols for students' safety. So it's like a certification program that is repeatable, that is evidence backed up with evidence that is proven, that also records and sees the shift in the safety and the well-being of the institution and students. And it's a very interdisciplinary approach as we go forward. It is evidence-backed, so it is built on a lot of rigorous research that has been done by our team. The courses are CPD accredited by the Standard Office of UK, and it is also validated by the Mindful Dignity Lab from University of Michigan. UGC and NEP align. Lastly and most importantly, it's not just theoretical. We are also bringing it to the papers, and we are making sure that the things that we are providing under this movement, under SWISS program, they are UGC and NEP aligned. So the only international accredited program that maps to the UGC Uniform Policy 2026 and NEP 2020, Telemanas ready. And that is the credibility with which this program comes. What are the 5 core elements of SWISS Higher Ed? Number 1, we will make sure that every teacher and every staff of your institution are trained under gatekeeping certification. What is gatekeeping certification? It's a training program through which a person becomes more aware and equipped to recognize any warning signs in a person that are around mental distress and that can lead to some sort of societal ideation. They become equipped to respond to that human being in that situation and then refer that person to the right kind of support. Now, this program, how will be facilitators? We will have an offline workshop at your institution, followed by which your staff members and your teachers will get an online self-paced course for the same, which is like a 4-hour self-paced course with assessments and a lot of examples and theories. They can also download the content. Then, once they finish that course, they will get an ebook for the course for the same, and then they'll get the certification. Followed by which, after 6 months, we will also have a follow up session with your faculty to check in where they are feeling the obstacles around gatekeeping and help them in the right way. Also, this program is available in different languages: English, Hindi, Tamil, Telugu. And so that is the versatile approach that we bring with a gatekeeping program, because we don't believe that it's just a simple tick on the box. We believe that it will take a while for a teacher to really get a good handhold on this program, to get equipped and feel more competent in regards to being a gatekeeper, and that takes regular check-ins. It's not a one-time program. Followed by which we will also provide you certain policy toolkits, plus encourage your institution to build a mental health well-being center. Our policy toolkits have more than around 10 policy templates that can be adapted by your institution. But out of them, 4 are mandatory policies that will encourage your institution to adapt. There's a possibility that your institution already have those policies, then we'll simply review them and see if any changes or any add-ons are required. Otherwise, there are 4 policies. Number 1 is student well-being, second is staff well-being, third is grievance redressal, and lastly, we have anti-bullying. Yes, I'm so sorry. We have anti-bullying. So we'll provide you the template. We'll check in with you if you already have these policies in place. If not, we'll help you in implementing and having these policies established at your institution. And even if you have it, we'll just review it and we'll give some suggestions if required for add-ons. And then we'll have these policies in place. And you can also pick certain policies from our optional policies. There are 6 other policies that we'll provide you with the template. Moving on, the third part is we'll encourage your institution to have a monitoring committee and a wellness center that also comes under the UGC mandate. A constituted, trained team with appointed mental health professionals, a private counseling space, and an annual tabletop simulation exercise. And now we also encourage that this committee is interdisciplinary. So people from different backgrounds, they come and represent their background, their committee, and it's an interdisciplinary committee. So let's say one person from the administration staff, another one from 2 professors may be a part of it, a school counselor, maybe the head of department, or the principals. So in that way, it becomes an interdisciplinary committee. We also encourage you to have a student and a parent in that committee if you are comfortable with that, because that brings in the community insight of students and of parents as well, and it becomes easier and even more impactful to sort of address the barriers that institutions face towards student well-being and address them more inclusively. Followed by that, we will have quarterly faculty labs, where we will have 4 2-hour long workshop with your faculty members throughout the span of 1 year. These workshops are again very research driven. They are very impactful. We start by addressing the burnout and the well-being of the teacher, because we highly believe in the oxygen mask principle. Then we move forwards towards talking about themes like how to build an inclusive classroom, how to make your classroom more psychologically safe, what are the right ways of communicating with the students, how to feel more competent by building psychological first aid kits for yourself and also for your students. And we have a list of workshops that we will be providing. So this is where we also give you the space to pick what workshops do you think fit well for your institution, because every institution has their own struggles, they have their own system, they have their own needs. So that's why we have come up with a list of certain workshops that we'll give you the option of and you can pick. Lastly, we will also provide a crisis response and recovery support. So, God forbid, if there is any crisis in your institution, our team will directly work with your wellness council committee and we will address that situation together in whatever capacity it's required, from sending on site counselors to holding support circles to holding workshops or providing some communication guidelines around the situation. We will also have a 24/7 telemanus integrated helpline with a suicide prevention protocol, which is a structured rapid response and recovery when it matters the most. So these are the 5 core elements under SWISS hierarchy. Along with that, we also have mindful mentor series. So as I mentioned before, we are also collaborating and we are working with Mindful Dignity Lab, which is run by Dr. Ram Mahalingam, who's from University of Michigan. After 20 years of rigorous research, he has come up with this holistic mindful program, which has 7 components that I'll explain you in the next slide. But using his theory, his research, his work, and creating this 4-layered program for your institution is what we are bringing you to. The first will be a mindful mentor, where we'll train your faculty members and even peer mentors around presence, the pause, and your personal well-being. We start with our personal well-being. It has certain elements like practice the mindful pause, respond and don't react when the student arrives in distress, how to be more mindful in a situation, especially when you're recognizing a student in distress, sustain yourself, and also take care of yourself and prevent yourself from fatigue, and know where you have your limitations as well. Secondly, we come to seeing the student, which is a very compassionate approach, compassionate noticing and early identification. It includes spot when a student's pattern change and name the signs that means act now. See the whole person and do not judge them. Have a non-judgmental approach, have an empathetic approach, have a compassionate approach, because then only you will be able to help that child in distress, and not judge them for their cultural background or any sort of diversity that they bring with themselves. Third is the dignified conversation, where how we learn to have a more empathetic, compassionate, and supportive conversation and a very warm handoff. Once we have responded to the child, how do we hand off that child to the that student to the right sort of support in a more warm, compassionate, and supportive way. So open a check-in that invites rather than shuts down and asks the hard questions. Make a warm hands-off to the well-being center and 24/7 telemanus, not a phone number dismissal. So when we are referring a student who's in distress, we just do not forward the number of the counselor on WhatsApp and then we take a seat back. We make sure that we are having a warm handoff. We are with that student to that journey where we are providing them and encouraging them to seek help from the right kind of support. And then we take a seat back, but we constantly stay in touch with the situation through student or through the support system. Lastly, holding the cohort, crisis, post-crisis care, and the year. So, God forbid any crisis happens in your institution. Bringing mindfulness in that situation, bringing compassion, bringing empathy in those situations is what really helps us stay resilient and perseverant in that situation. So providing post-crisis mentorship and a reintegration plan that holds rejoice and recovery, work the terms cadence with peer supporters and feed the institution's UGC returns. So this is how our mindful mentor series look like for your faculty members and your peer mentors. Now this mindful mindset has 7 core features that Dr. Ram Mahalingam has come up with after his rigorous research. Number 1 is compassion, which talks about understanding suffering of others and acting to ease it. So imagine if the teachers, the faculty members, even the peer mentors can learn the skill to pursue situations more compassionately, which talks about being more empathetic and understanding someone's suffering and then providing them with the right kind of support. And that support can sometimes just look like listening to them. So that's the one component. Second is sympathetic joy, which focuses on genuinely rejoicing in the happiness and success of others. When um, a student accomplishes something or your peer accomplishes something, to have the capacity and the bandwidth to enjoy and rejoice in the happiness of their success or their achievement or their experience, instead of having a lower value experience of envy, jealousy, comparison. So that's the second domain. Third is intersectional awareness, seeing how identities intersect, finding common grounds across differences. This basically focuses on building a better sense of inclusivity, understanding that we all, our lives, we all are interconnected. And in order to accept others, first we need to accept ourselves and move towards creating a more inclusive environment and approach in our day to day life. Next is negative capability, which talks about staying open in uncertainty, sitting with the discomfort without rushing to resolve it. We all have a dark side, and this part talks about that. To have an acceptance of your imperfections, to have acceptance of others' imperfections, and staying open to some sort of uncertainties and sitting with the discomfort of those situations at times. Next is cultural humility, lifelong learning, supported, egoless, open, self aware, and self reflective. Cultural humility, again, is very close to intersectional awareness. Once we have intersectional awareness, which basically is about having awareness around the diversity that we are surrounded with, we shall also have cultural humility where we are not arrogant. We have the humility to be open to different cultures. We are open to different ideas, to learnings, and there is less of ego, there is less of I in that process. And we are more self aware and we are more self reflective. There is a better sense of internal locus of control in those situations. That's what cultural humility brings us to. Then we have wonder, which talks about rediscovering the miraculous in the familiar, renewing purpose and aspiration, finding wonders around us, finding purpose, reclaiming the meaning in your life. That's what wonder quality talks about. And lastly, generosity, helping others while keeping their dignity and self worth intact. Generosity is what we believe a society is blooming on or living on. So, having the capacity to help others, also recognizing generosity around us, recognizing who's helping us, sometimes directly or indirectly, that also brings us a sense of humility and gratitude. And so, also building the skill to apply generosity in your day to day life. So, this mindful mentorship program will train the faculties and the peers to incorporate all these seven interrelated qualities in order to have a more mindful and compassionate approach in their day to day lives, in the classrooms, and in the campus. And at the center of all these seven qualities comes dignity, which is mentoring with awareness, compassion, and respect for every student, the constant beneath of all four modules. Now, talking about the 5-tier compliance suite, under SWISS Essential Ed, and I think one suite is missing here, which is SWISS Foundation. Number one, we have light. So if you're so every campus is existing currently at a different capacity. You have different sort of resources, different capacities, different modules. So we have tried to create SWISS in a way that it is complementary to every sort of institution that is out there. Starting from SWISS Higher Ed Lite, where if your campus doesn't even have a counselor, then we will start by providing you a visiting campus counselor and a peer support starter. This will also be accompanied by a small training session for certain number of mentors and policy templates. Followed by which we have SWISS Higher Ed Bridge, where you have a counselor, but you believe that the counselors can uh, sort of use more support. So we have counseling cell capacity, training, and supervision and screening is what we'll provide you toward tools, assessment tools, by sending more support to you in form of workshops or mentorship or supervision. We will also be sending interns. I'll talk about it in the next slide. So that is to help you enhance the existing well-being initiatives at your institution. Then third is Swiss Essential, which I just explained, which has five core elements, and it's a full Swiss Higher certification with all six pillars that I explained before. Next, we have Swiss Higher compliance, where everything that was mentioned in Swiss Higher Essential will be there. Along with it, we will also have POSH and POSCO training for your faculty members, and it will have full UGC Uniform Policy 2026 compliance with it. Lastly, we have Swiss Higher Complete, which involves everything that we have discussed till now, plus there will be a physical external audit that will conduct at your institution, outcome research, and NAAC evidence. With this, we also have Swiss Higher Ed Foundation, which is not mentioned here, where if you believe that you just want your faculty members and peers to be trained in gatekeeping training, so then we provide a whole gatekeeping training program to all the staff members and faculty and even peer mentors at your institution. Now, staff your wellness center with Elevate interns. So we also have a program called Elevate, where we are training certain psychology professionals and even other professionals like from social work background or educational background under school counseling, and there are other courses as well. So we align and we combine Elevate with Swiss in a way that we will be able to send some interns at your campus. So staff at the center and affordability, where we'll place supervised Elevate interns on your campus to run the mental health wellbeing center and meet UGC mental health professional staffing without a senior clinician salary line. So they can help you with that. We will send these interns at your campus. They will be supervised and credentialized. So every intern who is sent to your campus to help you in that process, they will be supervised by our psychotherapists and clinical psychologists. And there is also present AI assisted tools involved in that process. Lastly, build your own bench. We do not limit your exposure to us sending interns at your campus. You can also encourage your peer mentors or your faculty members to pick up a course under Elevate and get trained and build your own bench around credentials and that sort of credibility. Now, what is it that your institution will gain through this program? Number one, the most important one, protect every student. The faculty trained to spot early warning sign means no student's distress will go unnoticed, and every intervention saves lives. Second is reduce institutional risk. Court mandated duty met, documented policies, crisis protocols, and trained staff sharply cut legal and reputational exposure. Third is improved student outcomes. With increasing psychological safety in your campus, definitely their academic performance will also enhance. With increasing perceived social support and help-seeking attitude, their sense of academic performance is meant to increase. Fourth is boost faculty well-being. The faculty is not just there to help the students, but we also focus on their own well-being. Because as I mentioned before, we believe in the oxygen mask principle. So faculty feeling equipped, not exposed. Quarterly labs are there to support them in that journey and reduce staff attrition and sick days. Next is strengthen reputation, a visible third-party verified mark on the institutional excellence. So you will get the Swiss certificate in your institution, as you can see at the right corner of the slide, something similar. And you can put it on your posters, in your flyers, in your brochures, on your website. You can circulate it around parents and students so that everybody knows that your institution has taken an extra step to make sure that your institution is psychologically safe, and your institution is taking all these initiatives to make sure that we build a more inclusive and aware campus for everyone. Lastly, stay ahead of compliance. This program definitely helps you achieve all the UGC compliance and mandates that are out there, demonstrable before audit. So UGC Uniform Policy 2026, with that also NEP 2020 with CPD accredited approaches. Now we I'll bring you to the vision with which it started, which is that we believe that student safety is the need of the hour and student safety is a shared responsibility. So through Swiss Higher Ed, this is how every person or every representative contributes towards student well-being. Starting with institution, they achieve Swiss Higher Ed certification, the framework. They constitute mental health well-being center and monitor committee. They run quarterly faculty labs and tabletop drills. And lastly, they ensure that all the teachers are gatekeepers. For faculty and members and mentors, they complete the 4-hour CPD gatekeeper certification. Their deputed mentors hold a cohort at a 1 to 500 ratio. Notice change and lastly, keep anonymized records and protect their own load. Lastly, peers and families, the support network. For peer supporters, there is a ratio of 1 is to 100 for the early warning layer. Opt-in family module to spot the signs at home will also be provided. Engage the wellness center as active partners. And lastly, breaking stigma. So I missed out on mentioning this, but we will also be providing one workshop for your students, and we will also have ongoing online workshop for parents that they can feel free to join in, because in order to address student well-being, I think we all have to come together. We all need to start with becoming aware around different problems and what are the possible interventions and solutions, building skills and becoming more competent and equipped to address mental distress. And that's why we have created a wellness structure where we are conducting workshops and courses and different programs for all the population out there. Also, the proof. Swiss Higher Ed is built on evidence and trusted partnership. I have mentioned this before, but the gatekeeping training and our courses are CPD Standard Office UK accredited. Other than that, we also have Mindful Dignity Lab, which is run by Dr. Ram Mahalingam and the University of Michigan. And we also bring the Mindful Mentorship Program for your institution. Now, your path to UGC compliance. Achieve the full UGC uniform policy compliance in 8 to 12 weeks with a roadmap that is dedicated support and a dedicated support pathway throughout. How we'll start, let's say your institution is interested in having Swiss Higher Ed at your institution. We'll start by having scheduling a brief call, a 30-minute call where we will walk you through Swiss Higher Ed and where we look at your institution standalone. Then we'll follow it by compliance review, where we will map your current provision against every UGC requirement and find the gaps. I'm sure your institution might be taking certain steps and have certain training programs, policies, committees in place. So we will review that. We will sit together and see where your institution is at, and then we'll collaborate in a way that we recognize the gaps and fill those gaps by bringing a Swiss in whatever capacity it is required for your institution. Third is we customize the plan. So we recommend the right tier. Out of 6 tiers, after reviewing your institution, we will recommend you which tier will fit the best for your institution. Maybe it is just Swiss Light or maybe it's Swiss Complete. Really depends on where your institution is at, and we build a phased roadmap to certification. Lastly, we begin the enrollment, which starts with onboard cohorts, configure the platform, and start certifying back throughout. Now, as an institution, you will also be provided with a Swiss Higher Ed portal where you can keep a track of all the phases that we are crossing. So phase 1 and phase 2 will be about gatekeeping training, building the committee, and having the policies in place, and we'll cover it within the first 12 weeks. Followed by which in the next 9 months, we will conduct the workshop for your teachers and for your students, and we'll also have a crisis response in place wherever needed. So you will be able to track all this along with all the resources that will be uploaded on a portal. There will be anonymous, um, uh, reporting system there. There will be the helpline number mentioned. So we will walk you through a Swiss Higher Ed portal also, so that there is a clear transparency in the process between us and your team. Then It is annually renewal. Once your Swiss program finishes after a course of 1 year, we will renew it after an audit, and we'll renew it in a way to see what were the gaps that were still left, how to address them, what new components do we need to add, what are the changes that might be required into your institution. Because to address student well-being, and if we have a vision to have a campus where every student feels safe, every staff member feels competent and not burned out, then it's a long journey. And we believe it will need a few years of efforts and rigorous changes from our side and from the institution side in order to achieve that goal. So be the institution that stands up when it matters the most. You can scan this QR code to explore more about Swiss Higher Ed. We also have mentioned the email address below, which is swiss@mysafespaces.org, where you can write us any of the concerns that you might have. The website's QR code is mentioned, and we also have mentioned a number that you can call on if you have any queries around it and if you're interested. So by the end, I just want to say that if you want to enhance the student well-being at your institution, and if this whole webinar made you curious for even a minute, then I think you should give us a call or you should write to us and we should have a discussion. Maybe it will just end up as a discussion, or maybe something great will come out of that call. But if you find it curious enough, if you find it necessary enough, then do reach out to us and we will be happy to host you and answer all of your questions. Thank you so much for attending this and being so patient throughout the process.